I grew up as a skier, eventually a coach, an instructor, so I spent a lot of time abusing my knees. It impacted my ability to walk. I was limping. I couldn't ski anymore. I had been referred to Dr. Kayal. He assured me that when I got done with the surgery, I would look like I had normal knees again rather than having knees that were very almost deformed from the arthritic growth and the damage that had been in my joints. I really attribute a lot of the success that I've had post-op to the preoperative plan that Dr. Kayal has in place and the robotic component of the surgery. I felt very comfortable with the fact that we were going to have a pretty accurate outcome of the right device being implanted and then it being done properly through the process. And if my recuperation is indicative of the type of success that one has with the robotic device, then I would say it's really a dramatic piece of equipment to be able to have access to in this type of surgery. I had both knees replaced within a week of each other. Less than 3 months out of surgery now. I am cane-free, walker-free. My flexibility has returned pretty quickly. I'm up and down stairs, and it's been a life-changing thing for me. If I had known the type of success that I was going to have post-op, I probably would have made the move to do this much sooner. The fact that Dr. Kayal embraces technology and is willing to continue to learn and upgrade his skills, I think is a testament to his caring for his patients. My experience has been really excellent, and now I am just happy as a clam because this was the best thing I've done in a long time.